On a scale of 0 to 10, I would have ranked the pain about an 8 when I started in my left knee, my right hip, with different movements. And that's down to a 0 to 2. I am active with walking, and I would walk 4 to 6 miles a day and would have knee pain and hip pain. I would also have hip pain if I would sit for a few hours in my job. So I just wanted to have mobility without the limitations of discomfort. I had no reservations. I'm a friend of Aaron and Andrea LeBauer on Facebook and have been a friend on Facebook for a couple of years. So I would see things and read things. My children even encouraged me. I would talk about going to the clinic to get some help. And my children encouraged me, Mom, you need to go. So, no reservation. My physical therapist just taught me movement, balance, things that I would not do innately. And she would review everything at the end of a session, and she would send me follow-up emails. Some would have videos, some would be picture representation of the activity. She would put in the follow-up emails how many reps to do or how long to hold a position. Just things that I don't do in normal daily activity. So everything she has proposed has been a taught thing. I was the skeptical patient using virtual. So I received the email that the clinic would be closing and there were options to continue therapy via virtual sessions. And I replied with an email that I wanted everything, including a hands-on therapist or manipulation during therapy session, and preferred to wait until the clinic reopened. The response email from your clinic was positive. It respected me where I was comfortable, and I was encouraged to try a session to see. So I did that with reluctance, and it's been nothing but positive. And I know this because at the start of sessions, Caitlin, my physical therapist, will do assessments, and I will do assessments on my own in between. And then also I was offered that equipment would be dropped off at my home, and I offered to just come by and pick it up. So I went and picked up a roller, a band piece of equipment. Later in my therapy sessions, I picked up a smaller band when I do my squats to put around my thighs. So I had equipment from the clinic that is now my equipment to use during my sessions. They have been just as effective as I believe in person would be. I would recommend LeBauer Physical Therapy to anyone with joint limitations, limitations that limits activities of daily living. For me, being motivated to be mobile was not a goal because I had met that goal, but I was doing it with pain and wanted to work to try to decrease that. Not expecting to be pain-free, and pain is to a minimal level. So I would recommend it to anyone. You are welcoming. The first visit, you were informative. You covered how I would file insurance. You send me receipts at the end of every session. And then whatever you shared with me, just like Caitlin is physical therapist, is followed up with an informative email. And then during all of my sessions, I receive weekly emails from Aaron, Dr. LeBauer, with supportive information, just for a good general health to support mobility, movement. So the whole package, Right. Discomfort with my mobility is minimal. And on a scale of 0 to 10, I would have ranked the pain about an 8. when I started, in my left knee, my right hip, with different movements. And that's down to a 0 to 2. And I can sit for, like, one of my hobbies now is working with puzzles during this quarantine stuff. And when I get up, it would really be severe pain in my right hip.
Yeah.
And my gait would be tough, like getting my hips started. I don't have that. So I can tell improvement in my everyday activities and in my physical activities I do. Physical therapy to me is having the best quality of life and staying active with minimal pain. Being able to enjoy activities and not just push through them. So I had my mindset of doing the activities, but I would have to use a handrail to go upstairs. Whether it was knee or hip, any given day it could be different joint. And it's nice to not need to push through. So you're a 10 out of 10 for me.